progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio.
Welcome to Palmdale Regional Radio. I'm Prakash Chandran, and today we are discussing LSVT loud therapy for Parkinson's patients. Joining me today is Ting Su, a speech-language pathologist at Palmdale Regional Medical Center. So first of all, Ting, it's great to have you here today. Let's just start with the basics. Can you explain what exactly LSVT loud therapy is?
Hi, Prakash. Thank you for having me today. So LSVT, the full name is called Lee-Silverman Voice Treatment. So actually, it's a kind of speech treatment for people who have Parkinson's disease. LSVT also trains people for Parkinson's disease to use their voice at the more normal loudness level when they're speaking at home, at work, or in the community.
Okay, understood. And one of the things that I learned in my research is that for Parkinson's patients, the volume of their voice when they start talking tends to go down over time. Is that why this therapy exists?
Yeah, exactly. So Parkinson's disease, it's a chronic disorder of the brain that impairs a person's ability to move. So for them, they tend to shake their hands, their muscles get stiffness. So that's why their voice sounds kind of monotone, kind of breathy voice, and their voice loudness tend to be very soft.
Okay, so when exactly should a patient consider LSVT loud therapy? Is there a certain stage of Parkinson's disease that you typically see people for this?
So for LSVT, it's good for all stages of people with Parkinson's. The program, they kind of promote it, say that again. Sorry. So LSVT actually is good for all stages of Parkinson's disease. The program, it says, earlier the better, because LSVT is a lifelong learning, lifelong training, even though you only come in for a couple sessions. But after the sessions, you still have to do your homework, do your exercises to keep your voice loud. So that's why they said the earlier the better, so you can learn the strategies and then use it in your daily life to keep your voice loud. So I would say, no need to wait as long as you feel your voice getting softer or other people kind of commented on your speaking, I cannot understand you, or can you speak louder? Then I would say it's a good time to reach out to start.
Okay, that's really helpful. And Ting, I wanted to ask now just about the dynamics of how the therapy works. Can you talk at a high level about what people go through when they start LSVT loud therapy?
Yeah, for sure. So LSVT is intensive treatment. We usually do one-on-one. So if you decided to start a LSVT, we like to schedule we usually start 4 days a week for 4 weeks. So for totally will be 16 sessions. Each session will be 1 hour long. I will give you daily homework and daily carryover exercises to do. Because I mentioned before, it's a lifelong learning, so those exercises and homework are pretty important. So during the section, I usually will start with 10 functional sentences. So I would like you to give me 10 sentences that you probably use a lot during your daily life. So starting with those sentences and give you some cues, visual cues or verbal cues to keep your voice louder, and how to maintain those appropriate loudness. I don't want to say normal because everybody have their different voice loudness. So I would say your most appropriate voice for other people to understand you. Yeah, so we will start with the 10 functional sentences, practice your ahs, your highs, lows. So some of the exercise to help you to keep your voice loud.
Okay, can you maybe provide an example of how that works? So for example, what is a functional sentence that you might work with someone on? And then more specifically, how do you make sure that they're not going too loud? Like how do you help them gauge the volume level that they're speaking this functional sentence?
Yeah, that's a good question. So for example, if what's for dinner? If a person maybe he just every day he want to know, what's for dinner? But for people with Parkinson, maybe their voice, because it's not as loud as right now, maybe their voice kind of a little bit soft, like, what's for dinner? So for us, I would like him to kind of, so LVT is very simple because for people who have Parkinson's disease, if they're more advanced, they tend to be easily distracted. So if you tell them like, oh, okay, keep your body straight, take a deep breath, and then have a louder voice say, what's for dinner? There's so many steps for them to remember what to do. So for LSVT, actually really focusing on very simple instruction, just do what I do. I will do one time, and then you copy me. So usually I will say, all right, now look at me, and then do what I do. What's for, and I want them to copy me to use that kind of voice. If I feel like it's not loud enough, usually I will have a device on my desk to kind of detect how loud, like detect the dB, like decibel. I will know like, okay, right now it's only 40, but I know he can go up to 60 or 70. So I'll ask him, okay, I know you can do more, so let's do one more time. Do what I do. What's for dinner? So I want him, so I will do a couple more practice, and then until he gets the level that is more appropriate for him.
Yeah, I can see why that is so helpful. And especially just mimicking someone and having a device that measures decibel, you're able to visually see if you're talking loud enough, and you're able to copy someone in front of you. So that's fascinating. One of the things that I wanted to ask you about is I know that there's other types of speech therapy. How does LSVT therapy or LSVT loud therapy differ from those other speech therapies?
So for speech therapy is very broad. It's so hard to use one sentence and like, okay, what we do. So we do swallowing, we do like language, speaking, and we also do voice. So for LSVT, even though it's in the beginning, it was created to address issues for people with Parkinson, but actually also help out with other people with dementia or children with Down syndrome. So for, I would say, typical speech therapy, we kind of more focusing on people who have swallowing difficulties. So we will do neuromuscular and neuromuscular training, and also do some exercises to strengthen muscles. Or like people who had a stroke and then they have difficulty speaking, we will do some speech therapy to retrain or increase their receptive or expressive language. But for LSVT, it's more mainly focusing on your voice. So LSVT, it kind of increase your vocal loudness. It can help you to speak clear, increase your speech intelligibility, increase your facial expression. And recently, there's a research kind of shows that it can kind of help you with your swallowing function, especially for people who have Parkinson. It tends to, because we said the muscle, they get kind of stiff, they kind of tremor, so it's hard for them to move. So the LSVT can somehow help their swallowing skills. But and the research also shows that, well, LVT kind of help with their swallowing, but it cannot replace the swallowing exercises. There's no harm to do the LSVT to kind of help you with your swallowing, but if you have swallowing problems, you still have to go through the kind of like our typical way to do the swallowing exercises to strengthen your muscles. So LSVT, I would say, still more focusing on your voice loudness. It's not really. It's different, more focusing on your voice quality.
You know, this therapy itself, how long should a patient expect it to last?
So we only do individuals therapy. So it will be an hour. So total will be 16 sessions, 4 days a week for 4 weeks. So usually we have to go through, because they have a strict protocol, so we have to go through all 16 sessions. And then after 16 sessions, we will like to kind of couple follow-up sections to schedule probably from 2 to 6 months in between those kind of periods. Just want you to come in, just want to double check you're still doing your exercise good, your voice still keep at the loudness that we like to. And yeah, so that will be 16 sessions, and then with a couple follow-up sessions.
Okay, so let's say someone is listening to this and they are interested in getting this LSVT loud therapy for either themselves or a loved one. Do they need a referral from a doctor? How would they get started?
Yeah, I believe so. For speech therapy, we always need doctor's referral, and then doctor will refer the patients to our clinic. Then we will start doing the evaluation, and then if we think it's appropriate, then we will start the treatment sessions.
Okay, and just as we close here, you've probably seen so many patients go through this SVT loud therapy, and I'm sure you've seen some amazing results. If someone is listening to this and considering or is on the fence about getting this type of therapy, what's one thing that you would want them to know about it?
I will say homework is very important. Earlier, you're only coming in for 16 sessions, so it's kind of hard to this is not a cure. There's no cure. It's not like you're after 16 sessions and you are all good. It's like you are learning the strategies in these 16 sessions, and you have to keep using those at home and in your daily life. So practicing is very important, because I did see some of the patients, they had a lot of big improvement during the sessions. But after that, maybe if they're not doing a lot of homework, if they're kind of just getting lazy, not doing the exercises, and I can see the quality kind of just goes down.
Okay, so it's fair to say that you see the best results when people are doing their homework not only in therapy, but also after therapy is over. Because to your point, it is a lifelong practice to really get the tone and the volume right. Is that correct?
Yes, exactly.
All right. Well, Ting Ting, thank you so much for your time. This has been hugely informative.
Awesome. Thank you.
That's Ting Ting Su, a speech-language pathologist at Palmdale Regional Medical Center. For more information, please call 661-206-6250 or visit palmdaleregional.com/ROI for more information and to get connected with one of our providers. That concludes another episode of Palmdale Regional Radio with Palmdale Regional Medical Center. For more health tips and updates, follow us on your social channels, and remember to subscribe, rate, and review this podcast and all other Palmdale Regional Medical Center podcasts. Finally, please share this on your social media and be sure to check out all the other interesting podcasts in our library. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. Thanks again for listening. My name is Prakash Chandran, and we'll talk next time.